Hello again. This is Cancer Prevention Seminar, lesson number 4, and we will talk about risk factors for cancer. Especially today we are going to talk about smoking, that I consider the main risk factor for cancer. Someone might discuss and disagree with me on that, but still, as you see in the lecture, smoking is a problem in the world, and in some countries more than others. But in relationship to cancer, this is the main factor. As you see in this slide, made by the American Association for Cancer Research, you have the main causes of cancer according to importance. And you see that in the first place you have smoking or tobacco. Then you have obesity, that is the second, excess of weight or obesity or overweight. Then you have 5% for a list of other factors like diet, lack of exercise, occupation, virus, family history. And then you have a lower number for alcohol, 3%, the sun, 2%, prescription drugs, 1%, reproductive factors, 3%, pollution, 2%, and then we have 11% that we don't know. Then you see that we have 90 or 89% of the causes there, but 11% we don't know yet. So there is a potential that some of the cancers we have no idea what is causing that cancer, and that's the mostly for cancers like lymphomas or blood cancers or even brain cancers are not very well known. But anyways, we know 90% or 89%, so this is enough. The problem is that if we knew 90% of the causes, and these causes were one, is easy to target, but is multiple factors. There are multiple factors that affect the disease, and it's not just one cause, and that makes it a little difficult to examine or to make conclusions. Tobacco smoking is responsible for 1.9 million cancer deaths in the world per year. 60% of these deaths occur in 60% of these deaths occur in low and middle income countries. So it's not a disease only of the rich countries, because smoking is getting lower and lower incidence or in terms of less frequent in rich countries and more frequent in the other ones. Being overweight, obesity or inactivity might cause 274,000 cancer deaths per year. Then alcohol use might be responsible for 350,000 deaths per year. And here we have a group of cancers that are related to alcohol, like laryngeal cancers, and then mouth cancers, larynx cancer, and then other and liver cancers also. So you see that there are some cancers of the mouth and the larynx, and this area is all related to alcohol. And if a person drinks and smoke, the risk goes up and upper. And then we know that alcohol affects the liver, and 30% of the liver cancers are somehow related to alcohol consumption. And then we have the risk of cancer caused by infections or transmission, like the HPV or human papilloma virus, that is responsible for 235,000 cancer deaths per year. Most of these deaths are from cervical cancer, a cancer from women that is considered now a sexual transmitted disease. And then we have carcinogens that are transmitted during normal work for some people that have to work in environments that are very, very polluted. And the estimate is that 150,000 people die of cancer related to occupational pollution. So now let's go back and just summarize what we saw and what we are going to do from now on. We will start with smoking, and then in other sessions we will go with diet, obesity, exercise, and then we will have a third session on these risk factors that will talk about sexual behavior, alcohol, sun, and then the pollution and environmental influence. Tobacco smoking, as we saw, is responsible for 33% of all cancers. So I could say that most of the cancers are related to tobacco, but let's see it in a little more details. When we started suspecting that smoking was not a good idea, it all comes back to King James. Yeah, the same King James that facilitated translation of the Bible, the King James Version Bible. He wrote in 1604 something about smoking. A counterblast to tobacco. Smoking is a custom loathsome to the eye, hateful to the nose, harmful to the brain, dangerous to the lungs, and in the black, stinking fume thereof, nearest resembling the horrible Stygian smoke of the pit that is bottomless. So on that time, they already knew that smoking was not a good idea. Today we know that smoking is related to several types of cancers, as you see in the screen: lungs, lips, mouth, throat, larynx, trachea, esophagus, stomach, liver, pancreas, bladder, kidney, cervical. The same cervical that I mentioned about sexual behavior, and leukemia, and then colon cancer, and then skin and penis. You see that many of those cancers are not even in the respiratory tract, like the kidneys, the bladder, and the pancreas. But once a person smokes, this cancer substance will go through the blood and go to all of these distant organs. Animals naturally do not smoke. The idea to inhale smoke is not normal to them. These pictures are just for kidding. Nobody ever seen a cat or a camel or a horse smoking. These animals simply reject anything hot or with fire. It looks like we have to have brains to smoke. We have to make a decision to smoke. And many times we are very intelligent beings, but we make wrong decisions in our lives. So here you have our famous Einstein, but he was smoking the pipe. And we will see later on other famous people that decided to choose a behavior that was destroying their lives, even though they knew better. The major toxic agents in smoking, like carbon monoxide, the gas that goes out of the cars, it binds to hemoglobin and inhibits respiration. Ammonia, used in some products for cleaning, is okay to clean, but not in our lungs. It causes irritation in the respiratory tract. Nitrogen oxide causes lung inflammation. Hydrogen cyanide, you know cyanide is a poison. It can destroy the cilia in our respiratory tract and inhibits lung clearance. Hydrogen sulfide, it produces irritation in the respiratory tract. Acrolein is also destructive to the cilia and inhibits the clearance of the lungs. And then we have methanol that is toxic upon inhalation and ingestion. Other agents in smoking as the pyridine that produce irritation, nicotine that is the addictive substance in cigarette smoking and also can cause problems in the heart and in the glands or endocrine systems. Phenol also is a tumor promoter in animals in the laboratory. Catechol is a co-carcinogen in lab animals. And then aniline, that is a methemoglobin and affects the respiration. When I say methemoglobin, is that instead of having hemoglobin, will substitute the hemoglobin circulating in the blood, and this means less oxygen that is taken to the tissues. And then we have acrolein, that is a mutagenic agent. So we have everything in smoking, as we saw here, but there are many other compounds. There is an estimation that 4,800 different chemical substances are found in cigarette smoking, and 599 additives provided. This is a list provided by the tobacco companies. So we know that smoking is a poison because there are substances in smoking that can cause cancer, among other things that they can cause. So if you smoke, you will have all of these substances that are common in our lives, like acetone, that is a paint stripper, is in smoke. Acetylene, that is used for welding, is in smoke. Arsenic, that is a poison for insects, is also found in the smoking of cigarettes. Benzene, that is used in napalm, that is used in wars, is found there. Butane, that is fuel for lighters, is there. Cadmium, substance that used in car batteries. Carbon monoxide, we already mentioned that from car exhaust fumes. DDT, a pesticide, is there. Formaldehyde, that is the embalming fluid. Formol is used to treat cadavers in the morgue. Hydrogen cyanide, that is a gas used for capital punishment. Lead, that is used in old paint, and leaded gasoline, that is very dangerous for children, is in the smoking of cigarettes. Methanol, that is used in rocket fuel. Nicotine, that is a cockroach poison. Phenol, that is a toilet bowl disinfectant. And polonium-210, what? Yes, this is a radioactive substance found in cigarette smoking. The same one that is used in nuclear weapons. We are all concerned about nuclear powers and nuclear bombs and nuclear or atomic missiles being produced by some countries in the world that are not controlled, and we are concerned about that, what's going to happen. But we are less concerned about our own nuclear bomb that is inside of a cigarette because of polonium-210. Propylene glycol is an antifreeze. Toluene is an industrial solvent, and vinyl, that is used in chloride plastics. All of these in the smoke of a cigarette. There are 69 carcinogens in smoking, 11 human-proved carcinogens, 7 probably human carcinogens, 49 animal carcinogens, probably also human carcinogens. And then this was done by the International Agency for Research on Cancer, the same one that produced that book that I mentioned in the beginning, that is the Bible of Cancer. The 11 carcinogens found in cigarettes are those here: 2-naphthylamine, 4-aminobiphenyl, benzene, vinyl chloride, ethylene oxide, arsenic, beryllium, nickel, chromium, cadmium, and the famous polonium-210, a radioactive substance. Some people say, well, that's why I don't smoke. I prefer chewing tobacco. However, people who chew tobacco also have a risk. Mostly the cancers on the mouth, in the lip, in the tongue, in the palate, and in the pharynx are related to chewing tobacco. And then we have a story of a famous personage in our medical field. This is Dr. Sigmund Freud, was smoking his cigar. Sigmund Freud, the creator of the psychoanalysis, was a very heavy smoker of cigars. He used to smoke 20 cigars per day. Then he was diagnosed with a cancer, squamous cancer in the palate, in the upper part of the mouth, inside of the mouth. He tried to stop many times, but was not able to do it. What he was saying, when he stopped smoking, he was saying, this is literally his words: soon after giving up smoking, there were tolerable days. Then there came suddenly a severe affection of the heart, worse than I ever had when smoking. And he was being advised to stop smoking because of his heart. Somehow he was having tachycardia or something. And with an oppression of mood in which images of dying and farewell scenes replaced the more usual fantasies. The organic disturbances have lessened in the last couple of days. The hypomanic mood continues, and he was in depression. And when he had that, he would go back to smoke. It is annoying for a doctor, Dr. Freud was saying, who has to be concerned all day long with neurosis, not to know whether he is suffering from a justifiable or a hypochondriacal disease or depression. The torture being beyond human power to bear. This was his famous phrase when he would go back to smoke. The torture being beyond human power to bear. Many smokers have the same feeling, but what happened to Dr. Freud was that because of his continuing smoke, he got another torture. In summary, he underwent 34 surgeries because of that squamous carcinoma in the mouth during a period of 16 years, and he did not or was not able to stop smoking. At the end, he has to remove surgically his jaw, and then, but he didn't stop smoking, and then he died of cancer in 1939. That's a sad report for one that was the father of the psychoanalysis, and I would even mention the father of the psychology that was not known before, and everything in psychology today somehow remote to Dr. Freud. So, I will not make any other comments, but maybe it was psychoanalysis, psychology was not enough for him to change his behavior. Talking about mouth cancer, do you know that over 2/3 of mouth cancer causes are detected at a late stage, reducing the chances of survival from 90% to 50%? So if you smoke and you have not been to the dentist, go there because they will check inside of your mouth. And if you have any nodule or any lump or any wound inside of the mouth that is chronic, that is for a long time, you better check that. How to stop smoking? Now is our next and last section in this chapter of smoking and cancer. When you put a new nicotine patch, you are supposed to take the old ones off. And so many people are so addicted to smoking that they don't have they don't have the ability to think that they can survive without cigarette. How to stop smoking? There are first some behavioral techniques. It's important for a person to set a quit date. It's important to control the environment and get rid of all the things that resemble smoking, starting with cigarette packs and lighters and matches, and then maybe not being in touch with a person that smokes at least for 1 week or so. Find a support group. Find a person that can be your sponsor to stop smoking. Usually the best sponsor is the one that have stopped in the past. And this guy can be a very successful or at least resourceful person for a person that needs to stop smoking. Set up a system of rewarding. Keep all the money that you spend in a pack of cigarettes and then do something for you after you spend 1 month without smoking. You can imagine if you spend 1 month without smoking, considering $5 per pack of cigarette, you will have $150 to spend at the end of 1 month. You can imagine 1 year is going to be $1,000, $2,000 that you can do something for yourself. This is a good reward situation. That also regarding to substitution, it's important that smokers, they have all the time something in the mouth because of the habit of cigarettes, so they should put something in the mouth, and a toothpick or a sugarless gum, and then to take this will to have some, this habit to have some the cigarettes there. Also, they need to have something with the hands, and then it's good to substitute with like the stress balls or do some crafting that you use the hands would be a very good idea. Another interpretation of substitution is to use something that you start something new in your life. So when the brain is kind of decrease of an stimulus that is provided by smoking, the brain needs to have something to replace it. And then now is the time to practice or to put in practice something that you have thought for a long time, but you never did, like learning an instrument, a musical instrument, knowing or learning how to do a crafting, or knowing how to do some hobbies, or learning a new language, or start reading some manuals and learning a new craft in terms of doing things. If you can do things with the hands, as I mentioned before, would be very good. But it's important to substitute a behavior with something else better. Many people substitute with bad coping behaviors. Some people want to stop smoking and then they get in trouble with medication, with alcohol, with coffee, with sex, and this is not gonna work, because we'll create, many times we will create an additional addiction. So you will continue with smoking and you have something else that is even worse. And the final thing here is to develop a good lifestyle, to have a good diet. Today we know that a diet rich in meats, red meats, may make you to crave more smoking. A diet rich in pepper and that is too hot might stimulate you to smoke more. Alcohol also and coffee are related to smoking, are cousins of smoking. So try to avoid those things. And on the other hand, use more fruits and vegetables and natural foods, whole grains, beans, and roots, and drink a lot of water. So it's important to have a balanced lifestyle with diet, healthy diet, avoid junk food, and drink a lot of water, do exercise periodically, go to nature, have your lungs breathing pure air, go and visit places that we don't have, that there is no many people smoking. All of this is important. I used to say that today is the best time ever for a person to stop smoking. And the reason is that we have all of these behavioral therapies that were used and were tested that I mentioned before. And also we have more medical support that we never had in the past. So we have all sorts of nicotine replacement therapies, we call NRTs. But we have the patches, we have the gums, we have the lozenges, we have the spray, we have the inhaler. And then we have medications. We have Zyban, that is bupropion, and we have varenicline, that is the Chantix. And then Zyban and Chantix are the best medications. And sometimes you can somehow mix two of those, combine two of those. But for these combinations, you better check with your doctor, and he might do the right prescription for you. In fact, for nicotine patches, gums, and lozenges, they are sold over the counter, so you can do it by yourself. Usually, for you to have an idea, if a person smokes 1 pack of cigarettes per day, we advise to start with 21 milligrams of a patch, and then for 2 weeks, and then reduce to 14 milligrams for other 2 weeks, and other 7 milligrams for other 2 weeks. So it will be 6 weeks for a person to stop smoking, and would go in decreasing order of concentration of nicotine, and the last 2 weeks of the treatment would be without any nicotine. But pay attention that for any treatment you will be safe, mostly 90% safe that you are not going to smoke once you pass the time of 6 months. Then you can say that you are in maintenance and you are not a smoker anymore. So don't play with smoking. Is a very addictive substance, and then do your best for that, and wait for the 6 months and do your lifestyle, and you will succeed on that. There are other things that people have tried, but those things are not being proved scientifically, like the e-cigarettes. And many people are going to e-cigarettes as a substitute for smoking. It might be a little less harmful than smoking, but as a treatment, it might not work. In fact, for kids, many kids are going for e-cigarettes now, and we know that e-cigarettes can lead to smoking cigarettes at the end. So you are playing with addiction or addictive substance that is nicotine, and e-cigarettes is pure nicotine. So it's like to use something addictive like cocaine and heroin instead of smoking. You will not do something like that. So, but using nicotine is similar to that. By the way, there are some research saying that nicotine is as addictive as heroin and cocaine. It might not produce the withdrawal, strong withdrawal that those drugs produce, but produce enough to consider an addictive substance. So then we have candies, dissolving candy with nicotine. We have chewing tobacco. We have powder or sniffing tobacco. But those are not being researched in terms of helping people to stop. Many people that stop smoking, they have insomnia and they have depression and they have anxiety after they finish. So it's important to use something that is a calmant. So I put a list of herbs like St. John's wort, valerian, passion flower, lemongrass, lemon balm, hop. Those are herbal substances that might help you to sleep well or sleep better and overcome the first days that you have without smoking. And the last one is the spiritual support. One time I have a patient that came to my office to stop smoking, and I gave everything that I mentioned here for the patient as a treatment. And then at the end I mentioned like that, have you had a devotional at the beginning of the day? He said, no. Yeah, I would advise you to start your day with a spiritual devotion. Whatever it is that you can read, a spiritual book, I would advise the Bible. But start your day with a meditation and a prayer or something that make you to start with a positive mind. And he was able to quit. This was one of the factors that helped him. Let me refer here about a story of a nurse that I met one time. She was not my patient. In fact, she didn't need my advice to stop smoking. She was a nurse working in a hospital, and she was smoking 1 pack a day, and she was ashamed of that because being a nurse and a smoker, it was sometimes irony for her to talk to a patient, and now she is smoking and the patient is smoking, the patient has a problem, and how could she approach that? And then there are some new laws that she was not able to smoke in the hospital. Not that she was working in the nursing home, nursing stations, but because there was no more rooms and there was no more places that she could go and hide and smoke. Even the bathrooms were putting some smoking alarms that we could not, or she could not smoke anymore. Then she started thinking that smoking was not a good idea, and then health professionals should not be smokers. But she was still addicted to nicotine. Remember, nicotine is as addictive as cocaine and heroin. She could just start chewing smoking, she was thinking, but that was gross. She could change to e-cigarettes, but still might be not permitted in the hospital. And then she said, well, maybe I have to stop. But stopping smoking is not as easy as people think. It has some side effects, or what we call withdrawal effects. So a person can start being irritable and can crave strongly for smoking, can be depressed, can be anxious, can lose his or her sleep for days, can increase the appetite, can have headaches, and cannot concentrate. So all of this is not good for a nurse, and she was concerned about that. How can I do that? But she decided that she had to quit. She liked to smoke, but smoke is a problem. Stop smoking would be difficult, but she has to move forward. She would try cold turkey, that we call, first. That means we don't advise that, by the way. We have so many other help that you don't need to go to a excruciating way to stop smoking. But cold turkey means without any help from medication. The only thing she would do is to decide to stop, and then she's going to start an exercise program. She will start running. That's what she decided. she was not doing exercise before, and she thought it would be a good idea. And she had a group of friends that would support her on that. She decided to go for it. She started running for a few blocks and then walking every day. And then she decided to stop smoking after 1 week of running. And then when you finish that week, she stopped it. And then at least she felt, at first, she felt some symptoms, some withdrawal symptoms, irritation, a little bit of anxiety, but not that bad. And then after 1 week without smoking, she did not feel any other symptoms. So Judith was able to quit smoking. After 5 years, she haven't smoked anymore. She was happy for what she achieved. And basically, she substituted nicotine for exercise. Today we know that nicotine is an antidepressive drug and releases more serotonin and dopamine. But exercise also releases serotonin and dopamine, and probably was this the effect that made her to be able to quit. We know also that runners might get to the point of reaching extreme pleasure while running, and maybe this happened to Judith. But would that be enough to counteract nicotine addiction? Well, it helped Judith. But in any case, even if you have to do any treatment, if you have to use the patches or use a pill, don't forget that exercise might be an extra help for you. In fact, it's very hard to exercise and smoking at the same time. So you could use exercise as another substitute. When you are craving for smoking, go for a run, and the craving might go away. And at the end of this presentation, I can tell you that the verse in Philippians 4:13 is applicable here. I can do all things through Christ who strengthens me. So if we start our day with a prayer like that Jesus is in our side, that Jesus can help us to overcome any addiction that we have, being smoking or alcohol or any other. And if we ask Him to protect us during that day, He will do it. And we will be successful. Thank you. And let's continue with our cancer seminar next time with diet and cancer. Thank you.